AOI was created to focus on repairing orthopedic challenges. Said a different way, broken bones. The genesis of this business was creating a device that could go to the inside of the bone, jack the bone back to where it should have been in the first place by using a balloon reduction device, and then surfacing or putting bone cement on the outside of that so that you didn't have to have that bone replaced with an artificial component. That business really had three segments. The business itself focused on Ascendex, which is a device and technology platform to treat vertebral compression fractures. You and I know it as elderly patients who are all hunched over. What's happened is their spinal bone actually compresses. So it's kind of like a building imploding upon itself. So what we do to relieve the pain, because now that implosion is pinching on nerves, so we go in and we actually go into the intervertebral body, the spinal bone. We act like a car jack to jack it back up. Then we pour in polymethylene methacrylate, which is something that you and I know as plexiglass, bone cement. That technology platform really has gotten us excited, just as excited as we are about what we refer to as BAMF trauma. BAMF trauma is a long bone fracture management system. That's a lot to say, but what it really means is if you break your arms, your forearm, your clavicle, your humerus, your femur, your tibia, your leg bones, those typically break in such a way that today the therapy is they bang a big metal rod down through the middle of it after they've reamed out a core or a passage to do that. Our desire was to be able to pass a very thin device down through the middle of the bone without having to ream it, lock that bone into place, and then 6 weeks later, remove the balloon device, the reduction device. The third technology platform is a cervical technology, and it's called cervical plate, but it's really not a plating system. What it really focuses on is an adjunct, a component of a system that is being designed right now in clinical trials by a bunch of other companies. We believe that a part of the solution to degenerative disc disease, it's where the disc is bad, not the vertebral body, but the disc itself. We believe that a component to fixing that degenerative disc disease is what our solution provides. The degenerative disc disease is really kind of like a jelly donut. When jelly donuts crack because they're stale, jam comes out. When the jam comes out, it puts pressure on the nerve endings. When those nerve endings start to cause so much pain, the surgeon will go in with a device that looks like a little bitty Pac-Man, and it nibbles away at the little jam. And when that happens and that jelly takes the pressure off the nerve, the pain's gone. What we never did in the past was look at the outside of the donut where the crack came from. Today, with technology, not ours, they can replace the jam of the jelly donut or the jelly. They can replace the annulus or the donut itself. But while they're accessing that area, we believe that they're going to need a ligament to help support that structure once they've done that surgery, and that's really what we focus on. The reason we're so excited about this marketplace is to date it represents over $700 million a year in sales. It started in 2002 at about $50 million a year in sales. The current technology was a great start. Our ability to deliver a better solution to yours and my grandmother is what makes it so exciting for us. The reimbursement codes are gaining higher and higher values, meaning that everybody understands that this is the procedure of choice. Our ability to deliver a better solution clinically is what we're all about, and we're excited to be a part of that.